You're listening to an audio blog from AvaMind, a mental health app created to support your well-being every step of the way. Today's reflection is Understanding Common Mental Health Conditions, a comprehensive guide. Before we dive in, a quick note. If you find these reflections helpful, please like, share, or subscribe. And if you'd like to hear Saul and Elia explore this topic in more depth, keep an eye out for the podcast version on our YouTube channel and wherever you get your podcasts. It's part of our series called This Is Not a Real Podcast. Cheeky title, Serious Conversations. Mental health is part of being human. Sometimes it's about handling stress that passes quickly. Other times, it's about challenges that last longer and shape how we think, feel, and connect. Millions of people across the world live with conditions like anxiety, depression, bipolar disorder, schizophrenia, eating disorders, trauma-related challenges, and more. But here's the truth. These conditions are common, they are treatable, and they don't define who you are. Let's take some time together to explore what these conditions really mean, not to diagnose, but to understand. Because understanding creates compassion, and compassion makes space for healing. So what exactly do we mean when we say mental health condition? It's more than just having a rough day. These are ongoing patterns of thoughts, emotions, or behaviors that cause distress or disruption in daily life. They can touch anyone, any age, any culture, anywhere in the world. Take a moment to check in with yourself. Where would you place yourself today? Thriving, struggling, or somewhere in between? Awareness isn't only about facts. It's about changing how we respond. When we recognize mental health conditions for what they are, stigma loses its power. People feel safer to ask for help, and families, schools, and workplaces can respond with compassion instead of judgment. Awareness can literally save lives by helping us notice when someone is struggling and by reminding us it's okay to reach out sooner. Now let's talk about anxiety. One of the most common mental health conditions worldwide. Anxiety isn't just worrying too much. It can feel like a racing heart, sweaty palms, tense muscles, or a mind that won't stop spinning. Conditions like generalized anxiety, panic attacks, phobias, and social anxiety can all disrupt daily life. Pause for a moment. How does your body tell you when you're anxious? Support might include therapy, breathing practices, lifestyle changes, and sometimes medication. With care, anxiety is highly treatable. Another condition many people know by name, but not always by experience, is depression. Depression isn't just sadness. It's emptiness, fatigue, and loss of interest that lingers for weeks or months. It can make even simple tasks feel heavy. Think about this. What small habit could you add this week to gently lift your energy? Maybe a walk, a journal entry, or reaching out to someone you trust. Therapy, medication, movement, and steady routines can all support recovery. Millions of people live full lives while managing depression. From there, let's move into bipolar disorder. This condition involves cycles of highs and lows, periods of elevated energy, sometimes called mania or hypomania, and periods of depression. These shifts are more intense than everyday mood changes. With the right support, often medication, therapy, and consistent routines, many people with bipolar disorder live meaningful and balanced lives. Now, let's take a look at conditions that affect perception itself. Schizophrenia and other psychotic disorders can involve hallucinations, delusions, or disorganized thinking. These conditions are often portrayed with fear, but in reality, many people live stably with treatment, therapy, and community support. Understanding them helps us replace fear with compassion. Next, let's talk about eating disorders, illnesses that are often hidden. Anorexia, bulimia, and binge eating disorder are not about vanity. They're about control, coping, and identity. Eating disorders carry serious risks, but recovery is absolutely possible with medical care, therapy, and supportive guidance. Imagine this for yourself. What would it feel like to have a peaceful relationship with food and your body? Some conditions are less visible, but still deeply affect relationships and self-image. Personality disorders involve long-standing patterns of thoughts and emotions that make life harder to navigate. These include borderline personality disorder, narcissistic personality disorder, avoidant personality disorder, and more. With therapies like DBT, schema therapy, and family support, many people find new ways of relating and thriving. Let's shift to trauma and the ways past experiences can echo into the present. Post-traumatic stress disorder, or PTSD, and complex PTSD develop when traumatic experiences don't heal naturally. Flashbacks, nightmares, hypervigilance, and emotional numbness are common signs. Reflection moment. What helps you feel safe and grounded when stress feels overwhelming? Therapies like EMDR, grounding practices, and safe relationships offer hope and healing. Finally, there are conditions that don't always make the headlines, but affect millions. Obsessive-compulsive disorder with intrusive thoughts and compulsions. ADHD with challenges in focus and impulsivity, but also strengths like creativity. Substance use disorders when coping strategies become harmful. And often, these conditions overlap, showing us that mental health is rarely simple, but always human. So what can we take from all of this? Mental health conditions are not rare. They're part of the human experience, and they don't define who you are. With the right support, people can adapt, recover, and thrive. And if you're listening inside AvaMind, here are some ways you can take this further right now. Listen to calming music or sleep tracks to reset. Save this guide to your collections so you can return to it later. Play the audio version of other guides for deeper listening. Talk to Ava by text for reflective support, or call Ava hands-free, like speaking with a friend. Start your day with a daily affirmation. Track your mood and see how it shifts over time. Remember, you are more than your struggles. With understanding and compassion, healing is always possible. Thanks for listening to this AvaMind audio blog. For more reflections, explore the AvaMind app or join us on YouTube and SoundCloud. And if you'd like conversations with a lighter touch, check out our podcast, This Is Not a Real Podcast. Cheeky title, Serious Conversations. Stay gentle with yourself. Until next time.